As a healthcare worker in a hospital, you are often directly involved with caregivers on a daily basis. Even if you're not in a frontline role, understanding caregivers will help you gain a deeper understanding of what they do and why it matters. Caregivers are a crucial part of the healthcare system. In Canada, the value of the services they provide would be worth over $110 billion if they had to be replaced with paid care. Our healthcare system would collapse without the work of caregivers. As a hospital healthcare provider, your services help make sure caregivers are supported, and by better supporting them, you can help with achieving the following benefits: prevent the caregiver from burning out and becoming a patient, decrease hospital admissions by helping look after the care recipient, help reduce health system costs, prevent or delay the use of a long-term care bed, and help caregivers recognize themselves as caregivers early in their journey. Approximately 29% of the population of Ontario, or just over 3 million people, are providing care for someone. That might be a spouse, family member, or friend. The care provided can be, but is not limited to, assistance accessing healthcare services, cooking, transportation, managing medications, or helping around the home. A caregiver may provide support for a family member or friend. Caregivers can be young or old. Young caregivers might look after a parent or sibling. A parent might be providing care for a child, and husbands or wives care for their spouse.
For many caregivers, their journey starts with you, in a hospital after an injury or a new diagnosis. It can be the start of a long-term commitment that's rewarding and fulfilling for many, but it can also be challenging, all-consuming, and exhausting, physically, emotionally, and mentally. As caregivers, we do our best, but it can be lonely and difficult, and there are times when we need your support.
Caregivers can struggle with the burden of caregiving. If the care recipient has a complex healthcare condition and needs a lot of support, it can be more than 80 hours a week of care. They take pride in looking after someone, but they can be tired and need help and don't know who to ask. As a staff member at a hospital, you will often be in contact with caregivers. You'll see them in various locations and in most hospital units or departments, usually accompanying the care recipient. You can help them find services that make a tremendous difference in their lives. It doesn't take a lot of time, just handing them a brochure or card with information they can use to research supports that are right for them. These tips, designed by caregivers and providers, support helpful conversations. Healthcare providers who have used the toolkit have shared that using these tips hasn't added more work to their day. Instead, they believe it's made their practice more meaningful. 1. Ask caregivers how they're doing. We ask how the patient is doing, but few people ask how the caregiver is doing, which can contribute to feelings of isolation. This simple question alone can make a difference. Sometimes it's best to talk to them when the person they're caring for is not present. 2. Identify caregivers and include them as part of the healthcare team. They may have valuable information about your client that affects your care planning. 3. Tell caregivers what the plan is and what they can expect next. Knowing about schedule changes or staffing updates helps to relieve anxiety about the unknown. 4. Encourage caregivers to accept help. Caregivers find it hard to ask for help and feel they should be able to manage on their own. Caregivers who don't seek or accept support can be at risk of burning out. This means they and the person they care for will wind up needing additional services. 5. Help connect them to resources. The Time to Talk pamphlet and the website caregivershuronperth.ca have contact information for local programs and services. 6. Encourage them to talk to someone if they're feeling overwhelmed. It's not easy for caregivers to share. Confiding in one person is a first step and can help relieve anxiety and feelings of isolation. If they want to talk to someone, urgent support and crisis support is available by telephone. 7. Revisit this conversation as appropriate. It may take time for caregivers to seek or accept help, and their needs can change over time.
The care you provide to patients in our hospitals is outstanding and greatly appreciated. However, caregivers need your support too. Here are a few important ways that you can help caregivers. Guiding us to resources that can make it easier for us to find the services that we need, helping us to navigate our very complex healthcare system, explaining to us in our terms what to expect next, thus alleviating fear of the unknown. Lastly, listen to us. We are your partners in the circle of care, and working together produces the best outcome for everyone.